Hi, today I'm here with Dr. Megha Hazuria to discuss assessment during the school years for a child. So, first off, what is the necessity for assessment for children when they're in school?
So, Chandrika, typically students or children in school will be referred for assessment, or there will be concerns around assessments. If there are difficulties or any problems that are faced in two main areas, one of two areas. One can be behavioral, and the other is academic. So, if there are concerns, let's say, socially with the child, with peers, in emotional reactions that the student is behaving in a particular way, behavior problems in the classroom, attention concentration issues in the classroom and otherwise, because it is a social context for the child. So that is one big area where assessments can be referred to. And the other big one where the school system is concerned is, of course, academics. So if the child is not, for some reason, performing up to grade level expectations, with interventions or with support, they are still not being able to cope, or with the regular classroom teacher approach, it's not helpful, and the child is struggling to keep up with the class, with their age group peers, then assessments are recommended.
So, what would be, for example, key behavior that you keep in mind when you're looking at someone to recommend for assessment? For example, in the social context, is the kid just trying to look for attention, or whether there's a genuine problem? Or say academically, whether the kid is just uninterested in studying or genuinely suffering? What is the the tipping point where you start looking into assessment for the student?
Right. So typically what we look at in terms of, when is a lot of issues or problems, as we call them, are very normal in children, right? So like you said, they might be looking for attention, or they may be having a bad day in school, or there may be something going on at home and they may be reacting to some of that. But what I guess sort of our line or boundary is to say when is that particular behavior more consistent, is being seen again and again and again. It is not being with interventions or with over time, it's not going away. When there are feedback is being given, whether to the child or to the parents or environment, change is not happening. And when all these behaviors start impacting the normal functioning of the child. So if they are having more and more problems with peers, if they are having more and more emotional outbursts, if they are struggling more and more academically, if they are falling more and more behind.
So essentially when they fall into a pattern.
And when it is really impacting whatever their normal would be.
Okay, alright. So then what is the process towards assessment? What is step one?
So step one is our frontliners, what we call basically the teachers. Right? The teachers have the maximum contact with students in a school room.
Yeah.
And they are really our sort of frontline in terms of identifying problems or difficulties that a student may be facing. So the first step is for the teacher to recognize that there is something that they need support with for the child, or the child needs support with.
Alright. And from there you bring in various other people such as the parents, authorities in the school, all of that?
Yes, so typically what will happen is a teacher will notice problems or difficulties in a parent-teacher meeting, or through notes. They will notify the parents, they will have discussions with parents. They may involve few other people in the environment, like other teachers or staff members that may be required with the child. Typically some minor small interventions are made before the situation is escalated to the next level.
Which would be formal assessment?
Yes. So the final step would be the formal assessment. But before that, typically, like for behaviors, the teacher would put in certain behavioral measures to help manage. Parents would step in. Maybe with academics, depending on the level of difficulty, you'll put in extra support, teaching. And then if those interventions are not helping, then the referral for the formal
Formal
assessment
assessment.
to a psychologist would be made.
Okay, so for example, say in India, you can only be tested in, for example, for the CBSE board or for college, you can only be tested at certain institutes,
Yes.
and only certain tests are recognized.
Yes.
Which would these be?
So the tests are basically, they are standardized tests, right? And the institutes are typically, they will tell you, and this is only for the CBSE board. So before 10th, you know, other than for the board, you can go to any psychologist, a trained psychologist for assessment, and that is fine. That is not a problem. But it is, you know, for documentation purposes, a CBSE recognized place like NIPSED or AIMS, or, you know, they need to sort of provide you with the certification that there is a learning disability or a concern, because accommodations have to be given to the child.
So in the case of, say, a learning disability, what are the benefits a child can gain with official certification?
So there are many accommodations, what we call accommodations and modifications, which children get when they are diagnosed with and certified with a learning disability, which are very helpful for them in a formalized examination situation. So one of the most common ones that is given is extended time, because oftentimes children are not able to complete their work in the given framework. So children with learning disabilities get that extra benefit of getting extended time so that they can do their work to their potential. There is exemption of language for children who have difficulties in the areas of language. There are modifications that the school makes, you know, in terms of their curriculum, like in math, if there is a specific disability, or in reading or writing. If there is a specific disability in writing, depending on the extent of the disability, often a scribe can be given, which means that somebody else can write for the child. So in that regard, you know, there are many sort of accommodations that can really benefit the child perform to their potential in a formalized examination situation.
So staying with, say, learning disabilities, what is the role, say, for example, parents play throughout all of this, especially for the child when it comes to support and all of that? For example, you know, once a child is diagnosed, they're given pretty stringent labels, which can have, I mean, while they do get advantages such as scribes and extra time, it has a fairly negative impact on the student's psyche many times.
Yeah, and I think that has always been a concern with the professional community also, with this, you know, psychologist community also, because the aim, and one thing that I always say to parents, to teachers, you know, to the community in general, is that it's not about labeling the child, you know. It's not the label, it's not a learning disability or ADHD or, you know, conduct disorder or what we are looking at. We are looking at providing the right support to the child. That these are the problems that the child is facing, and what can we do best to provide the child so that they can perform to their optimum. So the label is only, you know, important or required in terms of providing a framework, so that it gives us as professionals, teachers, special educators, guidelines, you know, to say, okay, these are some areas that the child is struggling in and we need to help them. It provides maybe in some ways a documentation, which, you know, you require later on in life. But at that point in time, no, it's not the label to focus on it, and that's what parents should look at. You know?
Understood.
That we're going to support our child with the problems they are having.
And so a problem I noticed during, say, my time at the Learning Center was that many students who were not in the Learning Center from the beginning, with milder learning disabilities, tended to avoid attending classes because they had that constant fear of being seen as different. And because of that, they would refuse to get tested or go for assessment or treatment of any kind. How do you tackle those, I mean, a general way to help out in those situations?
I think one of the main things which most of the schools nowadays are doing is mainstreaming, right? Is where there is inclusive education, where all the children, whether they have a learning, what we call, right, is differentiated learning, right? So it's not about a child having a learning disability or not, it's about that each child learns in their own way. and even if they're not labeled, they still have a different way of learning. So teachers have to imbibe that culture. It comes from us as adults, it comes from us as educators, it comes from us as professionals, that we have to get that culture of that there is differentiated learning and everyone learns in their own way. So their information, education, starting from educators to professionals to the student community, to the student body, right, peers, for each other to be sensitive that there is differentiated learning, that we are different, there are differences in different ways, and that we are all together in that. So mainstreaming helps a lot in that, educating helps a lot in that, giving information helps a lot in that, demystifying the learning center, basically, right? That learning center is not this place, right?
Yeah. But so on that, would it be helpful, for example, if a student is in class with a learning disability, to explain to their peers exactly what it is, so they understand when the child needs, for example, help or needs to go for classes separately?
Yes, I think it's very important in general. I mean, whether the classroom has a learning disability student or not, I think it's a very important thing to sensitize our children, of all age groups to differences, of any nature. Whether, it could be a physical disability, it could be an emotional disability.
Exactly.
So sensitizing our student body, I think, is very important.
Okay. So, what is the average time it takes for assessment?
See, assessments, there's no really hard and fast rule around it, but depending, let's say a typical learning disability assessment, which involves cognitive testing, which is, testing of your intellectual abilities, your academic functioning, would take with the child, one can say about maybe 2 or 3 sessions at the most of an hour and a half each or so.
Okay.
Because we don't want to tire out the child during the assessment, so we tend to break it up into pieces so that the child performs their best, because even in that assessment it has to be a true measure of their abilities, which means they need to be fresh, not tired, not in a bad mood, all those things. And then some aspects of the assessment are like questionnaires that we want teachers and parents to fill out, which they do in their time and they send it to us, or if they need help then we work with them through that. There's a smaller part of that which involves interviewing with the parents, usually about an hour with the parents, maybe some time with the teachers, and an observation. So in some assessments we require, like with ADHD, we require classroom or school observations of the child. In which case, that's about an hour or 2 hours.
To see them in their natural
environment, yes.
So on that point, for example, since most people generally go for the, say for example, CBSE approved or government approved assessments, this is something what conditions should parents keep in mind when they take their children? Because usually these processes take up to 6 to 8 hours of waiting before the test commences. So is there some way to keep the child's mood up, or just have them rest the entire time, or?
Yeah, that's a good point. I think it is important for the child to be prepared for the assessment. It shouldn't be something that is just sprung up on the child. We are going somewhere and they suddenly land up in this place and they don't know what they're doing and why they're there. I think a lot of times there's hesitation on the parents' part. They're worried about how the child will react or how they'll feel about it. So they feel like, okay, let's not say anything. But I think it's important to help the child be prepared and say, look, you're struggling, there's some things, and we are going to somebody who will ask you some questions, do some, maybe you do drawings or puzzles, and they will try to figure out what are the best ways that you learn. And this is what I tell kids when they come to me for an assessment, that we just want to know what is the best way that you learn, right? What are your strengths? What are the ways that, the teacher should approach you? So the parent should prepare the child. And then for this waiting period that they may have before they meet the professional, I think it's important, one, the child should be rested when they do go in. So ideally, not at the end of the day or after a heavy school day or something, typically, if possible. And then, they should have eaten well, slept well, take something to occupy them, take some game, take books.
Because these assessments, you literally end up waiting for hours.
Yeah.
And then even between the various tests and assessments, there's a certain amount of waiting during which point the child would lose their focus, for example.
Right, right. So I think breaks are important. The professional will probably encourage that also. So take them out, maybe keep a few food items that they are fond of, so that can cheer them up as they're going, because otherwise you're in a place, the child is hungry, you can't find anything to eat, or what they like, things like that. So those things to keep in mind. As far as possible, I think a lot of it depends on the professional and the time constraints, but as far as possible, at least the assessment should be broken up over 2 sessions.
Okay.
One session is too long for a child.
Got it. And so finally I wanted to know, should students be tested at different ages? For example, at least I feel like their situation would change as they grow older based on what they're able to tackle, and then new things come up. For example, dysgraphia or dyscalculia will not come up till much later on in their lives when they have to tackle those problems.
Yes, very true. So yes, what we do recommend is every 2 to 3 years that a reassessment is done. More so, but not only because of the changes, but yes, because developmentally the child may be changing. Also with interventions, there could be changes, there could be improvements, the child could be progressing. So
points that, for example, they would have been weak in when they were younger, then you also see if the new learning techniques are working on them and all of that.
Absolutely, absolutely. But having said that, it is also at the same time recommended not to retest before 2 years, because there are certain standardized tests that are used, which are used universally, and those are the same tests that are repeated.
Also, then the kid may just copy his own results.
So the validity of the test is not
understood.
So unless there is some pressing need for a reassessment within a 2-year period, in which case it must always be mentioned what they were, like when they were tested last, and the report must always be shown.
Okay.
So, yeah.
I guess we're done then. Thank you.
Thank you very much.